Hey guys, in this video we're going to talk about matters of the burning heart, and more specifically, I mean myocarditis. Now, I know that looks like an intimidating term, but if we break it down, we'll see that it's not so complex after all. So, myo means muscle, just like the muscle in someone's arm here. So there's a guy flexing his arm. Card, which means heart, just like in cardiology, and itis, which means inflammation, just like in arthritis, which is inflammation of the joints. And there's some fiery inflammation there for you. So we see that it's not so intimidating, and it essentially means inflammation of the heart muscle. Now there's two main categories of causes of myocarditis, and those are the infectious causes, and can you guess what else? That's right, the non-infectious causes. Now, the infectious causes are going to be due to organisms invading the body that are not normally present and causing disease. And those are going to be things like bacteria, and one common bacterium that causes myocarditis is streptococcus, and there's a bacteria. Next, viruses can also cause myocarditis. One example is the Coxsackie virus, and viruses are much smaller than bacteria. So there's some viruses. Next, fungi can also cause myocarditis, and there's a fungus with a thick cell wall. And one example of fungi that cause myocarditis is the organism Candida. And lastly, parasites can also cause myocarditis. There's some parasites. One example is trypanosoma, which interestingly can also cause megacolon, where the organism causes the muscle cells in the colon to die, and the colon can no longer contract, so it becomes distended and fills with feces. And those feces balls actually become so large that they're literally called fecalomas, fecal tumors. And the reason that this is relevant is because when this organism infects the heart, it kills the muscle cells in the heart due to the inflammation, and it causes cardiomegaly, which is dilation of the heart, which we'll come to later. Now, the non-infectious causes include things like radiation. So in people who, misspelled radiation there. Now, in people who actually have tumors, they might be getting radiation treatment from their doctors. But if some of that radiation goes to the heart, it can damage the heart and cause inflammation. Next, drugs can also cause inflammation. Some patients are sensitive to certain drugs, such as penicillins, and this can cause inflammation in the heart. Another cause is autoimmunity. Autoimmunity is when the immune system of the body actually attacks its own body. And in this case, in the heart, it can cause myocarditis. And lastly, cocaine can also cause myocarditis. And there's some cocaine. Now, in the end, whether it's an infectious or a non-infectious cause, the damage to the heart is going to be caused by that inflammation in the heart. So in the infectious causes, for example, if we have some invading organisms here, as the immune cells come in to fight these guys and try to eat them, then there's going to be collateral damage. Just like in a battle where there's gunfire from both sides, there's going to be damage to the surrounding buildings, and in this case, the heart muscle cells are going to be the victims. And as these heart muscle cells die, this chamber of the heart is going to get dilated because these dead heart muscle cells are no longer going to be able to withstand the pressure inside the chamber from the blood. And this chamber will actually get ballooned out, and this is called the dilated cardiomyopathy or cardiomegaly. So this is going to lead to some effects on the patient, and some of those effects are going to be things like heart failure. And heart failure is a complex of symptoms, actually, where the patient's heart can't meet the demands of the body in terms of providing the body with the oxygen and blood that it needs. And so patients will experience things like shortness of breath, easy fatigability, and accumulation of fluid in the body. There's a heart that can't meet the demands put on it. Now, the heart also has an electrical system, and when that electrical system gets damaged by the inflammation, we're going to see irregular beats. And so where you might normally see a hear a lub dub, you might start hearing things like lub, lub, because the heart has lost its ability to contract in a regular and coordinated fashion. Patients may also experience chest pain. Now, just like you have pain in your throat when you have a sore throat and you have a lot of inflammation there, inflammation in the heart can also cause pain as it aggravates those nerves. So there's some pain. Lastly, the patient can also experience what we mentioned before, cardiomegaly. And as this heart becomes really enlarged, it's going to lose its ability to contract properly. Now, if a patient is suspected of having myocarditis, there are a number of tests we can run on the patients to confirm our diagnosis. And those include things like a blood test. And the reason we use a blood test is because during myocarditis, as these heart muscle cells are dying, they're going to release their contents into a blood vessel, which I've just drawn here. And these contents can be detected with our blood tests. Next, we can also use a biopsy, which is actually the gold standard for diagnosing myocarditis. And what we do, we thread a catheter up from the leg of the patient in the vein, and we come up to the heart, and we go into the lower chamber of the heart and take a piece of the heart tissue and then examine it under the microscope to check for inflammation or infection. Next, we can use an EKG, which is the machine that you commonly hear going beep, 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 and it's detecting the electrical signals in the heart to make sure that everything's okay with the electrical conduction system. And lastly, we can use imaging to look at the heart. And in this case, we use MRI, which uses magnetic rays, and we use ultrasound, which uses sound waves, to take a picture of the heart and check whether it's dilated or inflamed. Now, if it turns out the patient does have myocarditis, there are a number of treatments we can offer the patient. And those are going to include things like medications, and those medications are going to be for eradicating the organisms that are causing the myocarditis, like the bacteria or the viruses. There's a pill. Or drugs to suppress the immune system and reduce the inflammation, and also drugs to help with the heart failure, increase the ability of the heart to pump effectively, and give the heart less stress. Lastly, the patient will have to rest. The heart has been through a major battle, and the patient's heart is going to need rest in order to recover. So the patients are going to have to stay in bed for a while. Lastly, we're going to give the patient increased oxygen in order to get more oxygen to the tissues of the body now that the heart is weakened, and decrease alcohol consumption because alcohol has been shown to aggravate myocarditis. Now, on follow-up, we're going to need to have regular follow-ups in order to make sure the patient's recovery is on track and there's no complications. So we're going to have the patient have regular checkups so we can track the patient's progress, and the patient will have to ease back in to life. Ease back into the regular level of physical activity, and this is done to allow the heart to recover and not be suddenly stressed as the person gets back into their normal life after having been treated for myocarditis. So that's myocarditis, from infection to follow-up. I'll see you in the next video.